Hi students, today we are going to discuss about one more important small short notes, very short notes, that is neonatal hypoglycemia, right? Before that, what do you mean by preterm babies? Before the 37 weeks of gestation, right? Delivery before 37 weeks of gestation. Neonates means first month, that is 0 to 28 days. First month means infants. Neonates. Infant means 1 to 12 months, that is up to 1 year. That is first month to 12th month, up to 1 year is called as infant. Neonate is 0 to 28 days. Preterm is before 37 weeks of gestation. Now that question is, what are all the causes for neonatal hypoglycemia? This is actually 3-mark question or MCQ question. You just have some 4 or 5 points related to two classifications we are having. One is transient hypoglycemia, another one is persistent hypoglycemia, right? In your neonatal hypoglycemia, you are having classification, that is two types: persistent hypoglycemia, transient hypoglycemia. Now, what are all the causes? You just mentioned 2 or 3 causes for each classification. That is enough for short notes. Okay. In transient hypoglycemia classification, the first one is preterm birth, right? Second one is infant of diabetic mothers. Diabetic mothers always having some problem with the carbohydrate metabolism. So that also reflected in the babies. They will go for neonatal hypoglycemia. Third one is poor feeding due to some problem of mother or babies. Poor feeding, that babies also will go for neonatal hypoglycemia. Then some stressful conditions at the time of prenatal, right? For example, sepsis, asphyxia, that is respiratory asphyxia, hypothermia, then respiratory distress, birth asphyxia, and respiratory distress. These are all the stressful conditions that also lead to neonatal hypoglycemia. Glucose level will be less. Usually glucose means hypoglycemia means less than 50 milligram per deciliter, right? Hypoglycemia definition is less than, glucose level is less than 50 milligram per deciliter. Now coming to the persistent causes of neonatal hypoglycemia is, first one is von Gierke disease, that is glycogen storage disease in carbohydrate metabolism. Second one is gluconeogenesis. In gluconeogenesis, we are having actually 4 regulatory enzymes. It is pyruvate carboxylase, PepCK, phosphoenol pyruvate carboxykinase, and fructose 1,6-bisphosphatase. All these 3 enzymes, if they have any defect of all these 3 enzymes, lead to neonatal hypoglycemia, persistent hypoglycemia, right? Next one is galactosemia. The galactosemia means galactose 1-phosphatidyl transferase defect. The baby is always going hypoglycemia. Next one is fructose metabolism, that is fructose intolerance, or some books says fructosuria. Enzyme defect is fructokinase deficiency. Okay. Next one is, that is last one is beta oxidation, that is fatty acid oxidation defects. We are having small chain, medium chain, and long chain. In small chain absorption is no problem, so automatically it will be digested and absorbed. Whereas medium chain fatty acyl CoA dehydrogenase and long chain fatty acyl CoA dehydrogenase, these two types of beta oxidation enzymes always produces neonatal hypoglycemia if they are having any problems, so synthesis defect or production defect or excretion product like that. Beta oxidation, medium chain and long chain dehydrogenase enzymes are very, very important enzymes produce neonatal hypoglycemia. Okay.